morning, everybody. I am very glad to see you all within our faculty premises after a long time. First of all, I would like to thank the organizing committee for giving me this opportunity to share my views regarding the growing burden of diabetes in Northern Sri Lanka. In this presentation, I would like to highlight the burden of diabetes globally in Sri Lanka and in the Northern Sri Lanka. And also I would like to highlight the causes and contributing factors for the growing burden and strategies to manage the situation and future plan. The global burden, according to the latest statistics, 382 million people have diabetes worldwide. By year 2035, the number would reach 592 million. Unfortunately, half of them are undiagnosed and 75% of the total diabetes patients are living in developing world. As you all know, diabetes-related mortality is very high and is estimated as 4.8 million annually. Worldwide, 5% of the total deaths are due to diabetes. Globally, estimated prevalence of diabetes among adults is 6.4%, and this would increase to 7.7 by year 2030. Estimated global healthcare expenditure to treat and prevent diabetes is $400 billion. So here you can see the sharp increase of diabetic patients worldwide. Status of diabetes in Southeast Asia. In Southeast Asia, 81.8 million people are affected. Again, about half of them are undiagnosed. Compared to rest of the world, the prevalence is high in almost all Asian countries. Present trend indicates by year 2030, more than 60% of the world's diabetic patients will be in Asia. Status of diabetes in Sri Lanka. The prevalence of diabetes in Sri Lanka is 10.3 according to the national study. This national study has not covered the northern and eastern part of the Sri Lanka, and the prevalence is slightly more among female population. In Sri Lanka, the prevalence in urban population is almost double compared to rural population, and 36% of the total diabetic patients are undiagnosed, and this is relatively less compared to the world or Southeast Asia. Prevalence of pre-diabetes stage also very high, and the projected prevalence for diabetes for year 2030 is 13.5. Status of diabetes in Northern Sri Lanka. As I mentioned earlier, the northern province was not included in the national study. All the available data indicate that the prevalence is higher than the rest of the Sri Lanka. So far, there are no studies conducted to assess the status of diabetes in entire Northern Sri Lanka. So basically, this is the distribution of population in Northern Sri Lanka. The total population is 1,058,762. This is according to the census in 2012. More than half of the population live in Jaffna. The next populated area is Vavuniya. Only 25% of the total population live in Mannar, Kilinochchi, and Mullaitivu. So status of diabetes in Jaffna. In Jaffna, the total population is 583,378. Females are 30,000 more than males. Among the total population, 33.8% of population is underweight, under 18 years. So the prevalence of diabetes among the adult population is 16.4. According to this latest study, the prevalence is slightly more among males. And 27% of the total diabetic populations are undiagnosed. So this slide shows the growing trend of diabetic patients under the care of Diabetes Center Teaching Hospital Jaffna. As you all know, Teaching Hospital Jaffna is the only tertiary hospital in Northern Province. Currently, 10,058 patients are under the care of our diabetic center. This is the age distribution of patients under the care of diabetic center. 83% of the patients belongs to 46 to 75 age group. 8% of the patients are more than 75 years. 3%, that is 306 patients, are less than 25 years. This is the distribution of BMI among the patients registered in Diabetic Center Teaching Hospital Jaffna. 33.8% of the patients are obese and 7.3 are underweight. This slide shows the complication rate. Nephropathy is the commonest microvascular complication, and about 4% of the patients are having symptomatic cerebrovascular disease. Admissions due to diabetes-related complications are increasing in almost all the hospitals in Northern Province. This slide shows the increasing number of admissions to surgical unit DGH Vavuniya. According to the hospital statistics, diabetes-related admission to DGH Mannar also increasing. This slide shows the growing trend of diabetic patients under the care of diabetic clinic DGH Mannar. You can see the total number is almost doubled over a period of 4 years since 2009. The diabetes-related admission to DGH Kilinochchi also shows a sharp increase. In diabetic clinic DGH Mullaitivu, the total registered patients are 1,333. Rates of complications are relatively less in this hospital compared to Teaching Hospital Jaffna. This might be due to their active lifestyle. This is the overall status of diabetes in Northern Sri Lanka. The total adult population in Northern Province is 700,906. Estimated number of total diabetic patients are 105,135. Among them, the estimated diagnosed and undiagnosed cases are 76,749 and 28,386. rapidly increasing number of diabetic patients is basically a growing burden to almost all the units in the hospital, especially OPD, clinics, wards, ICU, CCU, laboratory, ophthalmology unit, dialysis unit, maternity unit, and PBU. As a whole, this is a major burden to the health sector. Dialysis unit of teaching hospital Jaffna is the one and only dialysis unit in Northern Province. Currently, there are 53 patients on long-term hemodialysis, among which the diabetic nephropathy causing CKD is 27%. In addition to this, several patients are getting intermittent peritoneal dialysis. Number of patients attending to ophthalmology unit for laser photocoagulation also increasing. There are a few interesting and promising data. The amputation rate coming down in DGH Vavaniya. This is indirectly reflecting the improvement of overall diabetic care. And amputation at teaching hospital Jaffna also coming down. This also again indicates the improvement of diabetic care in Northern Sri Lanka. Here you can see the high prevalence of diabetes in Jaffna compared to rest of the Sri Lanka, Asia and world. But the percentage of undiagnosed cases are much less in Jaffna. With the highest prevalence, keeping the lowest rate of undiagnosed cases is a great achievement. As you all know, the financial burden of diabetes is very high. This is a big burden to the government as well as the individuals. All the drugs are not available in government sector. Certain investigations like microalbuminuria and HbA1c cannot be done in government hospitals. In addition to state expense, individuals also have to bear the above cost. Patients also have to bear indirect costs such as productivity loss, transportation cost, and loss of earning. Anxiety, depression, pain, loss of enjoyment, stress, all this enjoyment stress or neuropathic pain due to diabetes also causing intangible loss to diabetic patients. The Sri Lankan projected prevalence for year 2030 is 13.5. But unfortunately, the current prevalence of Jaffna is 16.4. When you consider the diabetic prevalence, Jaffna is more than 15 years advanced compared to the rest of the Sri Lanka. What are the causes and contributing factors for the rapidly growing burden of diabetes in Northern Sri Lanka? Aging population. Yes, as you all know, this is a global problem. But the gravity of problem is more in Northern Sri Lanka because quite a number of young people have left the country. And we also have lost a lot of youngsters in the war. Stress and depression also important contributing factor. The suicidal rate in Northern Sri Lanka is very high due to stress and depression. Our people are adapted to poor quality of diet. This is basically due to financial problem and poor knowledge regarding healthy diet. Poor compliance and social support leads to a lot of diabetes-related complications. Compared to rest of the Sri Lanka, people of Northern Province have a lot of relatives and friends in abroad. To show their affection and love. Relatives and friends from abroad bring plenty of sweets and chocolate to Northern Sri Lanka. They never visit their relatives or friends without a chocolate pack. Annually, tons and tons of chocolates and sweets are reaching Northern Sri Lanka. This is also one of the contributing factors for the high prevalence of diabetes in Northern Sri Lanka. Carbohydrate addiction is fairly common in Northern Province. I don't know whether the previous intrauterine growth retardation due to the war, now manifesting as adult obesity or diabetes. You all know the intrauterine growth retardation is a risk factor for the development of obesity and diabetes. Our religious and cultural factors also contributing to rapidly growing burden of diabetes. Majority of our cultural foods such as pongal, aval, prasadam, modaham, panjamirdam, kolukattai, payasam, katkandu, all are rich in sugar. Unlike those days, northern people have adopted a sedentary lifestyle. So what are the strategies adopted by the health sector of Northern Province to manage this situation? The medical team of Northern Province is doing various activities to control the burden of non-communicable diseases, especially diabetes, at various levels by using all primordial, primary, secondary, and tertiary prevention strategies. Screening and health education processes are going on at various levels. Each MOH divisions, the medical and paramedical staff are conducting health clinics and screening programs. Northern Health Ministry is in the process of establishing Northern Health Plan, especially focusing on non-communicable diseases. Northern medical team is now concentrating more on early diagnosis of metabolic syndrome, which is a window of opportunity for early intervention. Efforts are being made to identify depression and stress early. This is the main cause of poor compliance. But we should intensify this process in future. Several community awareness programs are conducted by various medical teams. More than 10 community awareness programs have been conducted by Diabetes Center Teaching Hospital, Jaffna. This year, Diabetes Center Teaching Hospital, Jaffna has launched a public awareness website as well in Tamil. 11 health awareness books and CDs have been published by the Diabetes Center Teaching Hospital, Jaffna, and more than 11,000 copies have been distributed among the public in North and East and also diaspora. How are we going to modify our future strategy? We may have to pay more attention on primordial and primary prevention with the help of medical and paramedical staff. Introduce self-management strategy. We should train patients and their relatives we should make them actively participate in the pharmacological management as well. Give training on self-measurement of blood pressure and blood sugar. Train them regarding how to adjust the insulin dose, statin dose, and antihypertensive dose with the demonstration chart. Several studies have shown that the beneficial effects of this self-management strategy. Establish local and regional guidelines with the consideration of our social, cultural, religious, and genetic factors. We may have to establish guidelines for the management of some special conditions like management of diabetes during the Kanda Sashti Viradam or fasting during the festival days and so on. I don't know whether we have to revise our policy of family planning as well. Currently, we have severe shortage of manpower with 1 or 2 children in each family, with poor social support for elderly, aging of population, and stress. All are contributing for this rapidly growing burden of diabetes. At least we should encourage affordable families to have more children, and this will help to ease the situation in future. And we also should introduce the multidisciplinary approach to improve the overall care of diabetic patients. These are my few suggestions. We should get together and formulate a complete future strategy. Thank you.